to matters teenage pregnancy. I believe we really learned a lot also from our guest there. Ray. Now, COVID-19 has not just affected the way we live, with the issue of you have to mask, you have to sanitize, you have to keep social distance. It has also affected the economy on a global scale. One of the sectors that is reeling from the effect of COVID-19 is the real estate sector. This is an area that has seen a glut now in office space, and people aren't as much keen on focusing on real estate because everyone is focusing on saving. Then what are the dynamics for people already within this real estate sub-sector? We will be talking about issues of the real estate sector and our expectations going forward. I will be joined by a research analyst from Saiton Real Estate. That is Washo Mbogwa, who is going to be coming up in not too long to just help us, survey them or look at what the market is looking at. And the question is, should you invest in real estate at this point? That's a question we are going to be asking, or rather we are asking you this morning. But before we speak matters real estate, how about we sample just some of your feedback? Remember that we are live on KBC Channel 1, and our Twitter handle is at KBC Channel 1 News. Mine is at Ray Manyara and at Doreen Arange on Twitter. How about we just check out feedback that you've been sending us? Remember, thank you for having kept us engaged all the way from 7 a.m. We know we pulled through all the way till 10 a.m. Doreen, how about we sample the feedback that we have so far gathered from our viewers who are watching us from different parts of the country? Well, Doreen is still trying to get that on this smart board. We also want to remind you that also in our interactive segment, we're also going, rather than just talking about the issues of real estate, we're also going to be talking about COVID-19 and looking at, the state of preparedness from the county level. And we're going to be focusing on Nyandarua County. Last Friday, the results from the Council of Governors indicated that a majority of counties are not yet prepared to deal with COVID-19, despite, being given that particular, some targets, like, for example, there was a target of getting, or rather having, at least 30,500 beds in that category. Now, speaking about preparedness of counties in light of COVID-19, I'm joined by Francis Kimemia, who is the governor of Nyandarua County. Good morning, Bwana Governor. How are you? Governor Francis Kimemia is joining us in this conversation to just help us understand, rather just look at the status of Nyandarua's health care system in light of COVID-19. Good morning, Bwana Governor. How are you? Glad to have you on board on Good Morning Kenya. We just want to find out the status report of your county and what your administration is doing to ensure to stem the spread of COVID-19 within that particular county.
Yes,
good morning. Glad to have you on board.
Yes, thank you very much. We since the epidemic came into the country, we were able to sensitize our people. The hand washing has been going on very well. We bought more than 8,000 tanks in all the marketplaces in the county. The sanitization has been going on very well. And the masks, we are producing masks locally, and we have also been able to buy masks from the KEMSA. We spent more than 24 million shillings to procure equipment, PPEs and masks within the county. And I want to appreciate that the people of Nyandarua have been wearing masks, unlike other counties that I visit. And that's why we have been able to be safe until 2 weeks ago when we recorded two cases. Two cases have been recorded in the county, but we have been doing very, very well. We have more than 10 border points that are being monitored within the county. We have allocated more than 230 million shillings to fight this pandemic. It means that we have to stop some of the projects to put into that million shillings, not only to buy equipment, but also to buy food for the people who are very vulnerable, and also to come up with an ICU costing us 70 million shillings with 15 beds in the ICU, and we already have 330 isolation beds that have been prepared in the county just in case the epidemic escalates. So we only have two COVID cases as of now, and we hope that we'll be able to contain, because all the contact cases, 64 of them, they have been traced, 14 have been checked, and all of them are negative. None of them are positive. So we are hoping for the best as we put on. We have 9 ventilators in the county, and therefore we think that we should be able to handle the epidemic very effectively. We have more than 10,000 quarantine beds that have been identified in the education institutions, and they should be able to take care of our county in case we quarantine. The challenge will be the 330 beds. Are they adequate in case you have a full scale? That will be an issue that all of us in the counties are managing. And we have the inter-county initiatives. Just in case one county is overwhelmed, other counties can chip in and be able to help support the other counties in addition in coordination with the national government. It's not easy. We have not gone through it before. I think we have to behave out of the normal so that we're able to handle this abnormality normally.
Okay. Thank you very much, Governor, for that overview about what your administration is doing in regard to just remain safe, or rather, and also within, with the current COVID-19 pandemic. Just on Friday, we had some statistics from the Council of Governors that gave us that currently in the country we have only 442 ICU beds as well as 37 ventilators. Indeed, that your administration currently has 15 ICU beds and 330 isolation beds within the isolation center. I think that you have done some tremendous job there, and 9 ventilators, so to speak. You said that you have 10 border points that are being, this border points to just check the movement in and out within the county. But our question is, with the contract tracing and surveillance being dropped on a national level, then what is your administration doing to ensure, rather to monitor, rather increase surveillance? You only have 2 cases, and how are you going about, surveillance to just stem the spread of COVID-19?
Yes, we have several volunteers, more than 1,089 volunteers. We have the Nyumba Kumi system, and we have told them to check the new entrants from Nairobi and from other counties. You see, once the economy was opened up, we have seen people coming into the counties who want to know who are they, where have they come from, and so that they can also be encouraged to undergo tests. At the border points, of course, we are checking all those who are coming in. You can't stop children going to visit their parents, but you also want to make sure that they don't bring disease or bring infections to their parents. That's why we are encouraging children to still stay where they were staying, and to leave the parents to continue staying in the villages. They can send them support, they can send them food, they can send them money, but it will be advisable for all the particular middle class who are working in Nairobi and workers across the other counties to minimize contacts with the grandparents. The grandchildren coming to see their parents. Food can be sent. We have a lot of food in Nyandarua County. It can be sent to the homes. But I would like to urge the children and the grandchildren to still stay where they stay. Leave the older parents in the counties until we see how issues escalate or get contained. I think this is something I've not gone through before, and I know when I say this is with a lot of respect to children, telling children don't go and see your parents. But you see, it could be fatal. So you are better off leaving the old people in the villages. But the Nyumba Kumi system is also recording those who are coming back and those who could be infected. And we'll be able to trace them and get hold of them and get them treated. We are also addressing the issue of stigmatization. So far, we have not seen very negative stigmatization in the county, but people are very, very alert on new entrants, new people coming from urban areas, distant counties, infected counties to Nyandarua County.
Now, thank you very much, Governor, for that overview. You had mentioned earlier that your administration has set aside quite a significant sum of money, for, PPEs. These volunteers, the persons who are conducting the Nyumba Kumi initiative, how safe are these people when they're going door to door? Do they have the protective gear?
Yes, for now, you can't put all of them on PPEs, because the PPEs will largely be utilized by the medical personnel. But at least they have masks. They have gloves. They have to sanitize, and we encourage them to keep social distance even as they go checking, doing about their business. They have been trained. All of them have been trained and sensitized on how to take care of them. All our staff, 92% of our staff have been sensitized, and they have also been told that they carry the highest risk as they go about doing their business. They are aware that they carry the highest risk. They could be infected, and they could also infect their families if they're not careful. So that awareness has been shared amongst these people. So in terms of the preparing them for the job, that they are, and we encourage them not to. When you go in, don't start eating and shaking hands and doing all sorts of things. But it's mainly intelligence. Together with our intelligence system, they're able to track. The two cases have just been reported in the last 1 week. So we have not had an epidemic in the county. All the cases that have been tested, 650 of them, they are all negative, other than the two cases that I've talked about. So we are quite alert, and we want to make sure that as they do their business, they don't get endangered. And the training is continuous, and we want to increase the volunteer numbers, and so that they can also be able to educate our people, especially on how to take care, how to notice early signs, and then what to do. The hotlines are in place, so that they can be able to get in touch with the medical personnel as fast as possible.
Now, talking about medical personnel, we've seen over the last few weeks under the umbrella body, the Kenya National Union of Nurses, saying that they're threatening to down their tools because both at the national and county level, the frontline workers are not getting paid. What are you doing within your administration to ensure that there's continuity of healthcare services amid those complaints shared by frontline workers, especially nurses?
We have a very, very competent and very dedicated team of nurses and clinical officers and doctors, and the past can tell you we have never had a strike of our medical personnel in the county. We work very, very, very well. We have a very supportive medical team, and they have continued to demonstrate a lot of loyalty and patriotism in service delivery in the county. And they're in the forefront, training the volunteers, and the community workers. Can you hear me?
Yes, we can hear you loud and clear, Bwana Governor. Yes, we can hear you.
Yes, so they have been very supportive. We have, in terms of the equipment, the PPEs, we have adequate PPEs for them. At least I can assure you we do not have a problem. In terms of medical personnel, I would like to thank them 100%. The allowances have come, so all of them will be receiving the allowances for motivation to take care of their families. It comes in with a lot of patriotism that is required as per the ethics of the medical profession. The hypocritic oaths that they take, they have demonstrated that they can actually serve this country and the country and beyond very, very patriotically. And I want to thank them for that.
Okay. Thank you very much, Bwana Governor there, Francis Kimemia. And as we come to a close, there's something that you had mentioned earlier, the issue of inter-county support in light of COVID-19. How about you just expound on that particular proposal or a recommendation that you'd made earlier?
Yes, we have been meeting as a Central Kenya governors. We are 10 of us. I'm the chairman of the block, and we want to support each other and put our resources together. The PPEs, we are working very closely with the Kimathi University and Kenyatta University in terms of the developing the equipment that are required, both the PPEs and the ventilators. Kimathi University has come up with a ventilator just costing less than 1 million shillings, not the 5 million shillings that we've been spending. The issue of oxygen supply in mass in the county, we are sharing best practice, and we're also going to share the capacity. If Rakanidi does not have, say, ventilators, and we have ventilators, or Meru has ventilators, the nearby hospitals should be able to support each other depending on the spread of the disease. Rakanidi is still free, it's still clean. They do not have a single case, so they may not require ventilators. If it has a problem or Embu, they could very easily. If Nyeri has a problem and in Nyandarua we have a surplus, we could share. So there is strength in numbers and teamwork. So we are also looking at how we can create synergy of teamwork, both in terms of research, in terms of combating the disease, in terms of best practice, so that we can share from what we have, and including other blocks. Other blocks will be reaching out to Professor Nyang, in the region. Then what can we share with them, even in terms of best practice, in terms of symptoms, in terms of people, movements of people, and medical practice. What is the best practice that you can borrow from each other as governors? That peer learning mechanism, that's something we want to also leverage upon as we move on.
Thank you very much, Governor Nyandarua. That is Francis Kimemia giving us just an overview of what his administration has done to ensure that they remain prepared in light of COVID-19. Thank you, Bwana Governor. Thank you for your time. Now, just as Thank you very much. Thank you for coming on board on Good Morning Kenya this morning. Thank you. We'll be keeping tabs on, the preparedness of counties in light of COVID-19.